Hi guys, this is Wendy Holm. I'm one of the course faculty for N826. I thought I'd take a couple of minutes today to talk about the clinical project. It is a three-part project, including a presentation, a peer review, and a leadership paper. You'll want to talk with your individual course instructor who will let you know the due dates of each of those three components. The first part of this project is your clinical presentation. You will want to choose a topic that is pre-approved by your course instructor. I also have some notes in here. You'll want to choose something that is a little bit more narrowed. For example, you wouldn't want to choose the topic of schizophrenia, but you might choose one aspect of schizophrenia, maybe in a young population or something like that. Again, talking to your course instructor who will help you narrow it down a little bit. You should take a quick look at the competencies. These competencies you should know well. These are sort of the role expectations of what types of patients, families you will be serving, the communities, and what skills are needed. And this will help you set the framework for your presentation. When you're doing your presentation, you should have a level of presentation that's consistent with the graduate school and also with your APN and physician peers. So for this, you do have a lot of choice as to how you're going to show us what you know. So for this, you can, these are just some examples here. You could create a blog for other student APNs, a teaching video, a PowerPoint. Though if you're going to do a PowerPoint, you'll definitely want to do a voiceover. You can get Screencast-O-Matic. The free version lets you do a 15-minute screen capture for free, so you might have to do 2 short videos. And there's another little blog here that shows some other ideas. One great one would be compose your presentation so that it would fit a journal article, and potentially you could even submit that to the journal. When you're doing the presentation, you will want to create those learning objectives. So that's usually 3 to 5 learning objectives, and you'll want to revisit Bloom's taxonomy to give you some of the verbiage and outcomes that would be desired. Again, you're aiming towards the APN physician crowd. You'll want to also include a reference list at the very end. So here's the breakdown, and at the very end of this document you'll find a grading sheet that shows you where you get your points for this project. So you can read here. So current, practical, clinically oriented, evidence-based practice, that you should think about the interprofessional perspective here, and here's a little refresher document that we use a lot. How your chosen topic might be treated in population with comorbid conditions. So for this course for 826, we do talk a lot about chronic disease and comorbid illness. Hypertension usually also accompanies diabetes. For some of the mental health, they also have nicotine dependence or hypertension, so a lot of things go together. You'll also want to talk about integrative medicine, any therapies, in addition to pharmacotherapeutics, and we want to see that evidence of scholarly writing, again at that graduate level. So the second part of this presentation is a peer review. So once you've completed your presentation, you will give it to 1 to 2 of your colleagues, and you'll do this with your instructor's help and pairing you guys up. Peer review is very important, especially when you're asked as an APN to give a colleague thoughtful, concise, and a deep level of reflection feedback. So you'll do 1 to 2. This says 2, but it may be 1 depending on your class. And when you're writing this up, you should think about these kinds of questions. So what we're not looking for is saying, oh yeah, you did a great job on your paper, blank. Well, that's not very helpful. So really you should take a deep dive into these questions and also provide examples from within the presentation of how they met these criteria. This is likely about 2 pages long or so. The third part is the leadership paper. And for many of you, this is where you might struggle a little bit better. This is 4 to 6 pages. We expect it to be at the graduate level, written in APA format, and you'll also have a reference section at the end. Again, we're going to have you look at models of care for your patients with your selected topic. So we're looking at not only how does your hospital or clinic treat this type of patient, but how do others in your community treat this patient? How do people in maybe Europe treat this type of population, more of a global perspective? We want you to address how you as the APN can effectively coordinate the care for this type of patient. Discussing potential barriers to effective care. This could be insurance, this could be scheduling, lack of providers, lack of access. How does technology play a part? This could be anything from documentation to the ER to how EMR to if there's any red flags that will pop up for providers, warning them of certain things that need to be addressed. Maybe this involves telehealth. Talk a little bit about policy and practice issues. Are there any restrictions on how you can treat a patient? And then looking at the role in leadership in how you can address this disease. Is it you could change the policies within your clinic, how patients are treated, and again, this evidence of scholarly writing consistent with the graduate level. So that's just a small snippet. Within your D2L site, you should find the grading sheets. For example, this is the first part. So again, elements that should be included and possible points, and then some comments here. So I hope that provides a small bit of information for you guys for your projects, and we look forward to seeing them. Thanks a lot.